Today we're going to discuss business income. The affluent use businesses and business income to increase their wealth. Our group develops and operates small businesses to expand our assets and cash flow. Traditional investments currently provide a return on investment that's something less than 10%. So many people today believe that any return that's higher than that is simply too good to be true. However, business people wouldn't think of starting a business that isn't expected to produce income of at least 20%. That means a mediocre business provides income that's several times greater than the returns from traditional investments most people have. And it's important to understand that business income at those levels is not too good to be true, it's expected. We like the franchise model because we can buy a very small business, then expand it as we experience success. Over 51% of the products and services sold in the United States today are sold by franchises. This shows that franchising is today's most popular method of buying a business. About 95% of those who attempt to start a new business fail, while 95% of those who buy a franchise as their new business succeed. That means a franchise is about 19 times more likely to succeed than a non-franchise. Also, modern franchises provide management companies to optimize the performance of their franchises, so their franchisees buy companies rather than jobs. When we want to buy a business, we look in a strong industry. The medical industry is the strongest industry on the planet, and according to bankers, dentistry, a segment within the medical industry, has a 98% success rate. Dentists succeed at that level even though they receive almost no business training. Imagine what they could do if they combined business knowledge with their dental knowledge. Corporate practices make up about 20% of the industry today, and they have attempted to combine business knowledge with dental knowledge. It hasn't worked very well because corporations pay dentists less than they can make on their own. So corporations employ substandard dentists and provide substandard dental services. If we could work with single dentist practices and increase what the dentist earns by adding the right business knowledge, we would have a win-win business scenario. And if that model could be packaged and sold as a franchise, it would be one of the finest small businesses available. In 2002, the founders of Dental Support Plus met this man, Kevin Odell, and caught the vision of combining business expertise with dental expertise in order to make dentistry more profitable. Kevin and his father Levon had accomplished that in 6 dental practices by the late 1990s. So the founders of Dental Plus started a research and development effort to improve the Odell's model. They discovered that an average dental practice uses only about half of the office and staff capacity the dentist pays for, because the practice doesn't have enough patients. Then they invented direct sales in dentistry to bring a consistent flow of new patients so a practice can grow at a sensible, predictable rate. They discovered that patients must be pre-qualified relative to their dental needs, motivation to buy, and financial capabilities in order to maximize profits. They also found that business skills can be used to increase the percentage of profit per patient. Finally, they learned that this business partnership must be entered with an already successful, efficient dentist. Any other dentist arrangement lacks the efficiency and quality that the partnership needs in order to maintain quality dentistry and increase profitability. Dental Plus has invented a unique partnership arrangement that provides all of these important elements of success. They invented an approach that attracts already successful dentists with proven dental quality and efficiency. In the partnership arrangement, the dentist keeps 100% of income from the already developed practice, which Dental Plus calls the base practice. Dental Plus agrees to bring a consistent flow of qualified new patients to the practice, which they call the growth practice. Dental Plus is paid out of the dental income for those new patients. Dental Plus also commits to use its business skills to orchestrate increases in the amount of profit per patient. The dentist partner has no initial expense, and because Dental Plus isn't paid until one of its patients pays the dentist for services rendered, the dentist takes no risk. Both partners enjoy instant profits because their incremental expenses are easily covered within the practice's normal operating costs. The dentist's profit margins and income both improve, and because the sales value of the practice is based on its annual income, it increases as well. Here is a financial look at the American Dental Association's description of an average dental practice. It collects $700,000 of dental income each year. It accomplishes that servicing only 55% of the patients the dentist and staff could treat each day. It pays $455,000 annually for operating expenses. The dentist takes home profits of $245,000 a year. And at today's sales price of 60% of annual income collected, this practice would sell for about $420,000. Dental Plus puts together a partnership with an already successful dentist to bring additional new patients to the practice. They then begin contacting active patients with a survey about patients' impressions of the services they received, and they get referrals into the surrounding community. Dental Plus also contacts inactive patients to reactivate them and get referrals. The area Dental Plus develops through referrals is the dentist's market area. In that area, Dental Plus creates a network of friendly people who want to learn how to obtain and maintain affordable health care for their families. Dental Plus makes multiple educational contacts with these people about how applied knowledge can protect them from degenerative diseases. Dental Plus motivates prospective patients to optimize their dental health by teaching them how important oral health is to maintaining overall health. When its prospects are sufficiently motivated, Dental Plus refers them to their partner dentist to supply their dental services. A Dental Plus agent now schedules the new patient and suggests financial alternatives that would enable the patient to buy needed dental services. The Dental Plus scheduler also follows up to ensure that new patients show up for their appointments. Dental Plus follows a very simple formula to add to the success of its dentist partners. While they can bring 11.5 new patients a day, that would be too many. Dental Plus plans to bring 2 additional new patients each day to each partner dentist. The American Dental Association estimates that patients will spend between $1,500 and $3,000 each for dental services during their first year as a patient. Dental Plus has reduced that estimate to a more conservative $1,000. 2 patients a day for 5 days a week is 10 patients a week. 10 patients a week for 50 weeks is 500 patients a year. And 500 patients a year, each spending $1,000, brings $500,000 in additional annual income to the partner dentist. That income comes with no upfront cost, and because the dentist doesn't pay Dental Plus until the patient has paid the dentist has no risk. Now let's look at our average practice as expanded with the help of Dental Plus. Notice that the additional $500,000 in income is mostly paid for by the same 65% expense that pays for the dental services already being provided by the practice. The only additional operating expense is for dental supplies and lab work for the new patients Dental Plus brings. A rule of thumb for dental supplies and lab expenses is that they cost between 8 and 16% of income received. A cost-efficient dentist spends only about 8%, while a less frugal dentist spends up to 16%. We have labeled 8% of the $500,000 income as expense for dental supplies and lab services, and we labeled another 8% as possible expense or profit for more frugal partner dentists. So a partner dentist receives anywhere from 49% to 57% in additional take-home profits from the $500,000 of additional income for the practice. Also, 10% of this growth income covers Dental Plus's sales and marketing expenses. The other 25% covers Dental Plus's expansion and financing expenses and goes to the franchisee as profits. Dental Plus has developed cost-saving software for management oversight of its unique dental partnerships. It has created reporting software that takes information from the dental practice database, the accounting system, and its own support center software. Daily updated reports are delivered to Dental Plus and its partner dentists in dashboard format, including alarms for operating issues. With this software, Dental Plus can use just a few people to oversee hundreds of dental partnerships. The software recognizes and pinpoints the source of operational concerns and even provides suggestions as to how to resolve those issues. This software also reports on factors that contribute to the success of each practice and notifies Dental Plus's experts so they can study and share the advantages they discover.